Good evening, everyone. I am Dr. Satyabrata, MDDM clinical pharmacologist, and today I am going to discuss on ethics committees, role and functioning, committee formation, composition, registration, standard operating procedures (SOPs), role of individual members. Coming to introduction, an ethics committee is a committee formally designated to review and approve the initiation of a clinical research study involving human participants and to provide continuing review of the research study. Ethics committee is also known as IRB outside India, that is Institutional Review Board. Any institution and organization which intends to conduct biomedical and health research require ethics committee according to national ethical guidelines. Then committee formation. Formation of ethics committee is a new concept. In some corporations, a standing committee is formed to implement ethical concept into practice. These committees are directed by board of directors, internal as well as external. Coming to composition of ethics committee, heterogeneous group of at least 7 members, maximum 15, oriented to the cause of ethics, proficient to review and evaluate the protocols, synopsis, and should be qualified by training or GCP, good clinical practice, that is good clinical research practice. The composition may be as follows: CDSU Schedule Y Amendment 2005. There should be chairperson, member secretary, 1 to 2 basic medical scientists, preferably 1 pharmacologist, 1 to 2 clinicians from various institutes, 1 legal expert or retired judge, 1 social scientist, representative of non-governmental voluntary agency, 1 philosopher, ethicist, theologian, 1 layperson from the community. This is showing the requirements for ethics committee members. Every EC member must provide a recent signed CV curriculum vitae and training certificates on human research protection and good clinical practice GCP guidelines if applicable. Either be trained in human research protection and GCP at the time of induction into the ethics committee, or must undergo training and submit training certificates within 6 months of appointment or as per institutional policy, and be willing to undergo training or update their skills of knowledge during their tenure as an EC member, and be aware of relevant guidelines and regulations, read, understand, accept and follow the COI conflict of interest policy of the EC ethics committee and declare it if applicable at the appropriate time, sign a confidentiality and conflict of interest agreement, be willing to place her his full name, profession and affiliation to the EC ethics committee in the public domain, and be committed and understanding to the need for research and for imparting protection to research participants in research. Coming to registration, every ethics committee constituted under Rule 7 shall make an application for grant of registration to the Central Licensing Authority in Form CT01. The ethics committee shall furnish such information and documents as specified in Table 1 of the 3rd schedule along with the application made in Form CT01. The Central Licensing Authority shall scrutinize the information and document under Sub-Rule 2, validity 5 years from the date of issue unless suspended or cancelled by Central Licensing Authority, and renewal of the registration should be done after expiry 90 days prior to date of expiry. Coming to standard operating procedures, SOPs. The objective of SOP, standard operating procedure, is to contribute to the effective functioning of institutional ethics committee so that quality and consistent ethical review according to ethical guidelines can be maintained. And different institutes or organizations have SOP, standard operating procedure, of their own. So, robust SOP, standard operating procedure, required for maintenance of ethics committee issues for overall benefit in research. So, standard operating procedures: writing, reviewing, distributing, and amending standard operating procedures for ethics committee, constituting an ethics committee. Third is confidentiality agreements. Four is conflict of interest agreements. Fifth is training personnel and EC ethics committee members. Sixth point is selection of independent consultants. 7th point is procedures for allowing a guest or observer. 8th point is categorization of submitted protocols for ethics review. And the review can be A. Initial full committee review of new research protocols. B. Expedited review of research protocols. C. Exemption from ethics review of research protocols. 10 point is review of new medical device studies. 11 point, review of resubmitted protocols. 12, review of protocol amendments. 13, continuing review of protocols. 14, review of final reports. 15, review of serious adverse events reports. 16, review of study completion reports. 17, management of premature termination, suspension, discontinuation of the study. 18, waiver of written or verbal/oral informed consent. 19, site monitoring visits. 20, dealing with participants' requests and complaints. 21, emergency meetings. 22, communication records. 23, maintenance of active study files. 24, archive and retrieval of documents. 25, maintaining confidentiality of ethics committee documents. 26, reviewing proposals involving vulnerable proposals. 27, review and inspection of EC ethics committee. 28, audio visual recording of the informed consent process. Then coming to qualifications of individual members. Chairperson. Who can be chairperson? Chairperson should be non-affiliated and a well-respected person from any background with prior experience of having serving in an ethics committee. Coming to member secretary. Member secretary should be affiliated and qualifications is he or she should be a staff member of the institution, should have knowledge and experience in clinical research and ethics, be motivated and have good communication skills, and he or she should be able to devote adequate time to this activity which should be protected by the institution. Coming to basic medical scientist, he or she may or may not be affiliated. Qualifications: non-medical or medical person with qualifications in basic medical sciences. In case of EC ethics committee reviewing clinical trials with drugs, the basic medical scientist should preferably be a pharmacologist. Coming to clinicians, clinicians may be affiliated or may not be affiliated. Qualifications should be individuals with recognized medical qualification, expertise and training. Coming to legal experts, he or she may or may not be affiliated non-affiliated. Qualifications should have a basic degree in law from a recognized university with experience, desirable training in medical law. Social scientist, philosopher, ethicist, ethicist oblique theologian, may or may not be affiliated or non-affiliated. Qualifications: he or she should be an individual with social or behavioral science or philosophy or religious qualification and training and oblique expertise, and be sensitive to local cultural and moral values, and can be from an NGO, non-government organization involved in health related activities. Laypersons: layperson is the most important person in ethics committee. He or she will must be non-affiliated. Qualifications: literate person from the public or community. He oblique she has not pursued a medical science oblique health related career in the last 5 years. He oblique she may be a representative of the community from which the participants are to be drawn. He oblique she is aware of the local language, cultural and moral values of the community. Desirable is that involved he oblique she involved in social and community welfare activities. Coming to EC Ethics Committee role and responsibility. Before the study begins, EC registration, Ethics Committee registration, then having the standard operating procedures in place, investigator eligibility, site feasibility, and conflicts of interest, trial registration, regulatory approval, review of research proposal within reasonable time, decision making in formal meeting documented, issuing an approval in appropriate format, record keeping, meeting agenda, meeting minutes, decisions communicated to investigators, annual oblique final study report. These are before the study begins, the role responsibility of ethics committee. Then ethics committee role and responsibility during the study, review of all ethics committee notifications, amendments, protocol, informed consent document ICD, protocol deviations, review of SAE, serious adverse event reporting, analysis, relatedness assessment, deciding compensation, monitoring, informed consent process, IC process, monitoring study progress and periodic review of study conduct, communicating with investigator, research assistant, subject if needed, allowing regulatory inspection, record keeping, meeting agenda, meeting minutes, decisions communicated to investigators, annual oblique final report. Ethics committee role and responsibility after the study, review of SAE, serious adverse event reporting, analysis, relatedness, assessment, deciding compensation, communicating with investigator, research assistant, regulatory authority, regulatory authority, subject if needed, reviewing study report, post trial management, publishing, record keeping archival, allowing regulatory inspection. So there should be communication between with the investigator, regulatory authority, and subject if needed. RA means regulatory authority, INV investigators. So allowing regulatory inspection. Then coming to the functioning of the EC ethics committee. The ethics committee should function in accordance with the written standard operating procedures that provides detailed guidelines about the ethics committee procedures. The PI and not the sponsor communicates and deals with the ethics committee. Before the study begins, ethics committee, the investigator eligibility, site feasibility, and conflicts of interest, and also there is Communicating with during the study, communicate with the investigator, regulatory authority, subject if needed. After the study, also communicating with investigator, regulatory authority, subject if needed. Then coming to functioning of the ethics committee, the ethics committee should function in accordance with the written SOP, standard operating procedure, and the PI and not the sponsor communicates and deals with the ethics committee. Then coming to role of individual members, chairperson is the most important person in the ethics committee. He or she is responsible to chair the meetings and liaise directly with the director or officer in charge of the institute, report the meeting outcomes to the director, invite independent consultant to provide special expertise to the ethics committee on proposed research protocol, work in close coordination with member secretary, and he obviously has to review and sign along with the member secretary all the minutes, proposals, and work towards the smooth function of the EC ethics committee. Then member secretary, he or she is responsible for administrative aspect of EC ethics committee, organizing an effective and efficient tracking procedure for each proposal received, preparation, maintenance, and distribution of study files, allocation of project reviews to specific members to facilitate efficient dispensation of the projects, organizing IEC institutional ethics committee meetings regularly, preparation and maintenance of meeting agenda and minutes, receive and check for the completeness of the documents for review by the EC ethics committee, coordinate with the investigators for the translation of the PIS patient information sheet and ICD informed consent documents, arranging community members meeting after the board meeting for the finalization of the participant information sheet and informed consent form. Then basic medical scientist. Basic medical scientist, scientific and ethical review with special emphasis on the intervention, benefit and risk analysis, research design, methodology and statistics, continuing review process, SAE, serious adverse event, protocol deviation, progress and completion report. For clinical trials, pharmacologists to review the drug safety and pharmacodynamics. Then clinician. Clinician has to scientific review of protocols, including review of the intervention, benefit risk analysis, research design, methodology, sample size, site of study, and statistics. Ongoing review of the protocol, SAE, serious adverse event, protocol deviation or violation, progress, and completion report. Review medical care, facility, and appropriateness of the principal investigator, provision for medical care, management, and compensation. Thorough review of protocol, investigators brochure, if applicable, and all other protocol details and submitted documents. Legal expert, ethical review of the proposal, informed consent document, along with translations, MOU, Memorandum of Understanding, clinical trial agreement, CTA, regulatory approval, insurance document, other site approvals, researchers undertaking, protocol specific other permissions such as stem cell committee for stem cell research, HMSC for international collaboration, compliance with guidelines, etc. Interpret and inform ethics committee members about new regulations, if any. And social scientist or philosopher or ethicist or theologian, ethical review of the proposal, ICD, informed consent document along with the translations, assess impact on community involvement, socio-cultural contexts, religious or philosophical context, if any, serve as a patient or participant, societal or community representative, and bring in ethical and societal concerns. Laypersons, ethical review of the proposal, ICD, informed consent document along with translations, evaluate benefits and risks from the participant's perspective and opine whether benefits justify the risks. Serve as a patient participant community representative and bring in ethical and societal concerns. Assess on societal aspects, if any. Then coming to roles and responsibility of IEC Institutional Ethics Committee members. Regularly attend and actively participate in the EC Ethics Committee meetings, review, discuss, and consider research proposals submitted for evaluation. Reviewers for each proposal will review the study. Later, if any other issues, the other IEC members, Institutional Ethics Committee members, can voice their comments or suggestions, discuss serious adverse event reports, and recommend appropriate action, review the progress reports, and monitor ongoing studies as appropriate, evaluate final reports and outcomes, maintain confidentiality of the documents and deliberations of the IEC Institute Ethics Committee meetings, declare any conflict of interest, participate in continuing education activities in biomedical ethics and biomedical research. If deemed necessary, should suggest any changes that may be necessary to be included in the SOP standard operating procedures of the IEC Institute Ethics Committee. Conduct monitoring visits for any research proposal if needed. Then coming to quorum. What is quorum? A minimum of 5 members or 1/3 of the total members must be present at a meeting besides member secretary and chairperson in order to issue a valid advice and obligatory decision provided quorum is met. Then quorum requirements for EC Ethics Committee meetings. A minimum of 5 members present in the meeting room. The quorum should include both medical, non-medical, or technical or and non-technical members. Minimum 1 non-affiliated member should be part of the quorum. Preferably the layperson should be part of the quorum. The quorum for reviewing regulatory clinical trials should be in accordance with current CDSCO requirements. No decision is valid without fulfillment of the quorum. Coming to summary, Ethics Committee is continue to play an important role in the ethical conduct of clinical research. The EC Ethics Committee is responsible for reviewing the relatedness of the SAE serious adverse event to the research as reported by the researcher and determining the quantum and type of assistance to be provided to the participants. However, EC Ethics Committees as a system are facing challenges with paucity of trained experts and lack of supervising national body. So there is strong need to focus on capacity building and establishment of an efficient central body to include all EC's ethics committees under its umbrella to bring transparency and accountability in their functioning. So combined effort by DCGI, Drug Control General of India, ICMR, Indian Council of Medical Research, and individual ECs, ethics committees, will definitely promote a sound culture of clinical research. So, Valdemar W. Sejar, written, ethics is not definable, is not implementable because it is not conscious. It involves not only our thinking but also our feeling. These are my references: ICSGCP guideline, ICMR guideline, WHO guideline, NDCT, Rule 2019, CDSCO guideline. So you can go through these guidelines if you want to know and learn more about ethics committee. Thank you very much. Jai Jagannath. Please like and share my videos and watch my videos, subscribe my channel. Thank you very much.